You're listening to Forward Faster, bite-sized insights for entrepreneurs.
I'm Dustin Wilson, Startup Community Manager at NextCorps, where we run Greater Rochester region's largest and oldest startup incubator. I'm here today with co-founders of one company that's been part of our startup community for many years, Healthcare Originals. Sharon Samjitsingh has had asthma since birth, and she and her co-founder, Jared Dwarika, started Healthcare Originals to help those with chronic respiratory diseases take control of their health. Welcome, Sharon and Jared.
Thank you, Dustin. It's a pleasure to be here.
And it's a pleasure to be here also.
Absolutely. Thank you. So before we dive into your technology, let's talk about the problem you're addressing. Tell us more about why you founded HCO.
So I've had asthma since birth. I had a really bad time growing up, even though I took all my meds, which is what people said, if you take your meds, everything will be okay. Really wasn't. And I had really poor experiences growing up. But not only did it affect me, it affected my parents and everybody around me who just didn't have peace of mind. So it took me 25 years to learn how to live well with this beyond just medication-only therapies. And when we started this, we realized that even though significant time had passed, decades had passed, people with chronic respiratory diseases are still being told every day, if you take your meds, everything will be okay. And that's not enough. So we founded this to really help people live well with this condition, help those that care about them have peace of mind, because there's nothing more scary than seeing a loved one struggle for breath. And now I'm proud to say that what took me 25 years to do, we help people do that in 2 years or less.
Your solution involves a wearable, a mobile app, and an online portal. Can you describe how it all works together for us?
Yeah, it's a great question. We do a lot more than that. So that's our technology solution that forms the core of what we do. And the key is our wearable, developed at the University of Rochester, where studies showed that using the data from that wearable, we could predict healthcare utilization, aka asthma attacks, up to 3 months in advance. And that's remarkable and game-changing. Jared is a technical genius who took that very rough proof of concept, made it into the elegant wearable that we see today. It's worn hidden on the under clothing, so there is no face or GUI on it. So then we have the app, and the device speaks to the app, also sends data to the cloud. And so we can do Bluetooth to the app, to a phone or device, Wi-Fi to the cloud. And fundamentally, what it does is it measures all of the significant parameters of respiratory diseases, puts together a baseline for the individual, and helps them understand when they are trending away from their personalized baseline. And that is the way that we enable mass personalization at scale with a technology that uses non-invasive detection to do it. But technology alone often isn't enough when dealing with chronic care management. What we do is phenomenal with our technology. But as a company, we do a lot more. Because if I just sell you a device and that device says, hey, something is going wrong, what does the patient then do about that? They need to understand what's the next step to take. So that's where we surround our device with chronic care, self-management education, respiratory therapists, health and wellness coaches, behavioral health therapists that actually help people understand, hey, so my device says something is going wrong. Then we actually deliver self-management education to tell them, and this is what you do about it. And we offer personalized contact and touch points. We call that whole system our Nightingale virtual respiratory care solution.
And what's really unique about that is it is personalized care at scale, which is something that I imagine is really important when it comes to managing chronic illnesses.
Correct. Before our technology existed, the standard of care for respiratory was measuring 4 to 6 breaths in a device that you blow into once a day while sitting down. We breathe 20,000 times a day. While I understand that was the best people could do before our technology, and it's great, any high school level math, 4 to 6 breaths out of 20,000, taken at a point in time that is not representative of what you're doing every day, really provides no real context. And so what we do is we enable people to detect their symptoms objectively in real life, in real time, as they live, work, and play. And there's a wealth of data and opportunity that we are able to tap into by just exploring and getting that data set.
So we know our experience running an incubator that startups have different needs at different points in their journeys. Some clients come to us, leave, then come back to leverage support from a different vantage point. HCO has been a part of NextCorps since before we moved our facility from Henrietta to downtown in 2018. What support did you initially take advantage of to help your company in its very early stages?
That's a great question. And I'm a big fan of what incubators like NextCorps do, the contribution to the Rochester community. I always tell people that Rochester is still a place where people make things. We make physical things, but we also have the coding skills to back it up. So for us, Rochester has been the perfect combination of digital and hardware that we needed to get our device going. In the very early days, we were part of the student incubator at NextCorps before you moved downtown. I asked Jared to talk about some of the experiences we had there.
Right. And the things that a startup needs, a lot of it is coaching, the know-how to develop your idea and take it from idea stage into a product. And that is what we got from the whole NextCorps ecosystem. Back then it was called Tech Rochester. And we got the coaching on, everything from doing your business plan, making the whole business case that would appeal to an investor. Beyond that, how you start preparing for rolling out a product, getting customer feedback, just answering the question, will somebody buy this product when it's completed? And so those are like the foundation skills any startup needs. And we were able to obtain that at this incubator. Then fast forward, you're building a proof of concept. You need some funding, you need some know-how. And we have these manufacturing excellence programs. We have little grant programs that will allow us to further that proof of concept. Even take the proof of concept into not just a physical product, but maybe a bit of marketing that you want to develop around the product. And here you were able to, and you still are able to tap into those resources. Basically everything you need to take a product from idea into reality.
And one of the things I'd add to that is community. We started as the Student Startup Incubator after winning a prize at the University of Rochester for this business. And it's thrilling to see companies that were in that incubator with that little room. So everybody had one desk in a room. I remember it well. And companies like BZ Design were actually in that room as well. Now BZ has grown by leaps and bounds. They helped us with our design of our housing, and now they run a fab lab here at Rochester. So I think the aspect of community is something we've always bought into. And while this is about us, it's amazing to see the strides that others have made because of that community.
Yeah, it's interesting. You mentioned sort of the growth you've seen at the other organizations here, but you too have grown at NextCorps. You're currently in one of our largest offices here. So I was wondering, could you talk a little bit about what your current team looks like and, how has your need for support really changed?
So our current team, it covers logistics, product support, of course the whole medical aspect, our therapists. We have on board a chief medical officer, then sales staff, front office staff. So the team, it's nicely rounded out now, right? What you would expect from a startup that's on the verge of scaling and scaling well. And basically what that means, to get to a nice, well-rounded team like ours, it does not happen overnight. So the support from NextCorps, you can actually tap into product matter or subject matter experts for, say, marketing, industrial design. And there you get a bit of the know-how. These experts help you until you can have your own team to run with it further. And that's something key that comes from NextCorps, right? Within that community that Sharon spoke about, you have all of these people in the multidisciplinary aspects of the community there waiting to help you and guide you. And experts from the industry, not just theoretical experts, but people who've done it and been there before, and they can help guide you.
As an example of our journey, our specific journey, so we started in the student incubator, eventually took an office, and then NextCorps was outgrowing its location then and moving downtown into Sibley, but we couldn't wait. So we actually rented a separate office from NextCorps, but we stayed as an affiliate member because there was so much value to be derived from continuing to be affiliated with NextCorps, even if we couldn't be physically present. And as an affiliate member, we were able to tap into those manufacturing excellence programs that Jared spoke about. We were able to get grants for really learning how to do a disciplined sales process, all while not physically located within NextCorps. And then, of course, we've kept an eye on how the community has grown, the beautiful space down here in Sibley, in downtown Rochester. And we are committed to downtown Rochester revitalization and being present here and growing here. So when the opportunity came up for us to really move locations, we were thrilled to be able to come back here and continue to contribute to the community and hopefully have others see how far we've come and continue to help others grow as well.
Yeah, that's fantastic. Startup is a temporary term, right? So,
well, yeah, then they also say every startup is an overnight success, 10 years in the making.
Yeah, 10-year overnight success, exactly. Exactly. With that in mind, as you guys look back, could you share some of the more pivotal early moments or decisions that you had to make that kind of changed the trajectory of where Healthcare Originals was going?
Yeah, that's interesting. Jared probably has a couple too. Do you want to go first or?
Okay, so there are a couple. When we just started, we were like, yes, we'd write an app and everybody would run it on their phones and we would be that overnight success, right? But then we looked into the medical utility of the product and what we were trying to solve for and realized we could not just be another app given a solution that really did not meet practical end or practical service to people with medical problems. So we had to go down the route of building a physical wearable. So that was like a turning point, the realization that hardware is involved. A next turning point, of course, it's a turning point for many people when COVID came along and we're like, our core business model in the research area, and that meant, you have to meet subjects, you have to monitor coughing, and COVID really played a number on that. So we stayed true to our promise and built out what Sharon described, our Nightingale virtual respiratory care program. So again, that was the next turning point for the company.
And I think there's a lesson to be learned in that around mission, purpose, and distraction. So we started with a very clear aim that we wanted to help people directly with asthma and COPD. When people learned that we were able to monitor coughing and other factors on an ambulatory basis in real life, in real time, as we like to say, we had customers come knocking on our door. So all of those great startup resources that we talked about said, hey, the inbound customer is the best customer. And so what happened is our first market ended up being in clinical trials with pharmaceutical companies and researchers. And we had a really strong pipeline before COVID, hundreds of thousands in sales and millions of dollars in the pipeline. And we rationalized that with mission in our mind by saying, hey, what we're doing is really fundamentally helping people have diversity in clinical trials, which ultimately impacts people like me because then drugs and therapies are developed to help people of all ethnicities and races versus just having a very select group. So we rationalized that in our mind. COVID forced us to have a thought again because our pipeline almost disappeared because everybody pivoted to COVID studies. The studies that were continuing. It was a great market for us, but it forced us to have a conversation about, was that market really fulfilling our purpose? And then I'll never forget one of our board members saying, well, this isn't why I invested in you, and it isn't really very exciting for me. I thought we were going to help people directly. So I would say that was a pivotal moment for us in terms of just, okay, let's refocus on mission. Yes, what we were doing is very necessary. Maybe it was tangentially related and we can come back to it. So in 2021, we actually spun up what we call our Nightingale virtual respiratory care solution. Again, with the support of someone from the community who is also an investor, launched a pilot within 5 months of spinning that up and collected data for 2 years that to this day has shown that what we do is remarkable in improving outcomes. Helps us to be independently validated, and then also has led to the sales and contracts that we have today. So I emphasize the pivot, but I also emphasize the importance that community has. People who are willing to give you that direct feedback that, hey, this isn't what you said you were going to do. Being able to recognize that, and then also having the community step in when you pivot and help you.
Yeah, it's really interesting, the importance of having that validated North Star to help keep you back on track.
Mm-hmm.
You mentioned this a couple of times, having the pivot. One of those largest pivots was going from a software company to a hardware company augmented with software. Could you talk a little bit about what that pivot meant and
Mm-hmm.
kind of what you had to overcome in order to develop a hardware product when it wasn't even your initial purview?
I'll say that we are incredibly lucky to have Jared on board. He's very unassuming, but really a real expert at building things from first principles. What I'll say that led to the conclusion is there was no other way to capture deep organ sounds than what we do now. And relying on a phone or other devices developed by others intrinsically could not enable personalization the way we meant it. So we had to capture real good signals. We had to develop a product that actually was independent of Wi-Fi. So we do something very particular. All of our AI and machine learning actually runs on the device. So we compute at what's called the edge of the cloud. We do not need the cloud to compute, which is very different from most wearables today. And then Jared can give us a little bit more detail around what had to be done from a hardware perspective, which again, we were able to get a grant to help us with that from Buffalo this time, but still, yeah.
Going from a software, you can imagine you just stay and, write up some code, develop an app, and put it in the app store. So it's a different mindset when we decided on a hardware. And that's the time we decided to do it. It's around the time that a lot of developmental assets were being made by others in the electronics field. So thankfully, we were able to leverage what we call developmental boards, things like that. And we looked around the community, got different people with different skill sets. And of course, skill sets to put in place the vision we had, the design or the architecture. And as Sharon mentioned, because we knew we were headed to being a medical device, we took the guidance from the FDA, which is, you do your specifications from the beginning and you document the entire process. So going from a software where you just do something overnight to a hardware, I think it meant that we had to make sure we follow the medical discipline, the discipline you need for a medical device, and not just simply adapt or run with the same way you do a software for an app for an overnight success. You had to do it more methodical approach.
So with a couple of pivots under your belt now and a fairly clear North Star, can you share what sort of traction or validation you've seen from your customers?
It's been very rewarding. So I would say commercial success, we knew we had that in clinical trials and we could have continued down that path if we wanted to. I count traction a little bit differently from most, but we do have solid traction. But let's talk the emotional and the North Star moments first. Within 3 months of launching our Nightingale program, we had people coming back to us and saying, hey, I used to have attacks every month before this. I have no more attacks. That continued for the first year. We had 2 out of 3 people who were having attacks every month before joining our program had no more attacks. Within a year, everybody reported reduced symptoms, and 90% of people reported improved sleep. And we had people writing testimonials for us. They quit smoking because they were able to get their breathing under control. We had one woman who was diagnosed with adult onset asthma at the time of perimenopause, which is a thing, like if we don't have to deal with enough. But then she was able to, she had stopped singing, she had stopped jogging, she had stopped doing everything that brought her joy. And she was able to get back to all of this. And it really comes back to that whole thing around peace of mind and bringing joy back to people's lives so they can thrive with their condition instead of just striving to control it. Now let's talk about the stuff that everybody else wants to know about, which is the commercial traction. So I'm thrilled to say that last year we were the first respiratory focused solution and the first wearable solution to be validated independently for outcome improvement by the Validation Institute. They're an entity that has been around for more than 10 years that validates digital health companies to make sure that what they're saying, they claim they do, they actually do. And they validated that, yes, our outcomes are statistically significantly improved compared to the status quo. And so that was a fabulous point. But we've really been working for the last 12 to 18 months to focus on commercial opportunities. That was a necessary proof point along the way. So I'm proud to say that, we are actually in a collaboration with the Asthma and Allergy Foundation of America, where we're rolling out our Nightingale solution to adults in Texas, in underserved communities. And you understand the power of a collaboration with the leading advocate for people with asthma and allergies in the US. That's more powerful. That's an important traction point for us. We are currently deploying in a school in Pennsylvania and looking to use that as a model for how we not only lift communities, but also then get deployment throughout schools in Pennsylvania. We have been approved as a preferred purchasing partner for an employer healthcare purchasing coalition that has 400,000 members. And we have other deals signed for organizations that have 500,000 members. So in total, we have more than 500,000 lives under cover. We have contracted annual recurring revenue of $5.5 million. A new deal will be signed in May for another $3 million. So traction-wise, $8.8 million in contracted annual recurring revenue, with a lot of people converting in the pipeline now, because what we do is just so differentiated and it's so clear that we add value. One of the things that has helped people sign with us is also that we're so clear that we add value, that unlike most companies in the digital health space, we provide performance guarantees. So we guarantee them that there will be these outcomes by a certain time. And people like that. And we're seeing increased traction because of it.
Great. Yeah. A lot of great stuff happening, a massive impact being held. So outside of sort of sharing that story and, closing what you have in the pipeline, what's next for Healthcare Originals?
What's next?
Scaling and scaling well.
Scaling well. I'll ask Jared to share on the technology front, and then I'll talk on the business front. Yeah.
Okay, so on the technology front, we actually have an Adam. Adam is the name of our wearable, right? ADAMM. And we actually have a version 3 in the making that came out of us realizing that there's so much more we can do. We are already sitting on the upper torso, might as well capture a lot more data and be applicable for many more use cases. So in that new version, we've increased our sensors to more frequency detection, things that beyond the audible hearing range. And we've also added some cool features for people who are using it for just simply health and wellness, like step counting and basic things like that. The app, you can track other medical devices in it. So it really becomes one system that you can go to for many conditions. And that's on the technology side.
On the commercial front, we are raising a round of funding, a round of $3 million, where we have a lead already committed. Sapphire Partners out of Boston is a VC firm with over $1 billion in assets under management, and they are leading our round because they see the promise of our technology. Simultaneously, you would have already realized that community is important to us, as is democratizing access to not just care, but capital. So we're also raising a part of that round of funding on WeFunder, which is an equity crowdfunding platform. So not like GoFundMe or those other things, an SEC-certified equity crowdfunding platform that allows everybody who can invest from as little as $100 and up, has an opportunity to invest in our company on exactly the same terms as our lead investor. So you'll see that's another demonstration of our North Star, where democratization of access to care, democratization of access to personalized data, but democratization of access to our success. Because there's very little risk left now from a technology perspective. We have great signs of product market fit, and we're moving forward to use funds to scale. So that's on the fundraising front. We anticipate with the deals that we have anticipate signing that we'll probably be scaling faster than we thought, which is a good problem to have. And we will be EBITDA positive by second quarter of 2026 and cash flow positive shortly thereafter, which is key for us in terms of our growth. Expansion into other use cases, other organs that sit in the chest. You can guess what those are. And we have a couple of global deals that are under consideration. So international expansion.
Excellent. And so from a technology perspective, obviously the tech space is changing radically right now. Where do you see sort of your guys' tech evolving and healthcare originals playing a role in the next 5 to 10 years?
If you look at the entire world as our market, we have everybody from the developing countries all the way up to the countries that are sophisticated in their care delivery. But in every single one of those countries, while the technology increases in leaps and bounds, you still have very large communities that need to take advantage of data collection every day in a real-time perspective. So that's where our technology fits. And it's basically almost everybody who has a chronic illness, and they need to take control of that chronic illness. So by expanding the technology into many use cases, other disease types, we use one product, one set of signal capture to then interrogate that signal for many diseases. And that plays a key role in people, especially people with comorbidities, many diseases, and really makes a difference in how they can control, especially with the interplay between one disease and the next disease, because one disease may accelerate the exacerbation in another. So in the years to come, especially with Adam 3.0, we've built it so that the capability of it lasts for many years to come before we need to roll out a new version. And we continue to evolve and adapt how our core technology works so that maybe it takes advantage of, say, faster Wi-Fi communication, get information to key people much faster. So we've considered all of those things as the infrastructure in the world changes, that the device is already set up for it and can take advantage of the technology.
And I think the elephant in the room always is AI and how we make use of it, because we are AI-enabled tech. So probably share as much as you can about that, given that this is public. Yeah.
Yes, again, in the medical world, it's despite the increase in technology, it still has to be regulated to some extent. So we use AI and we fix the way the AI operates so that it's repeatable to some extent. That's allowable within the medical world. So we've built already into the product the capability to use new and emerging AI technologies. So AI, of course, is how we accomplish a lot of what we do today. You can imagine as the AI models get even more powerful, everything we do just gets even more powerful. And maybe we analyze much faster. Maybe we see things that digital biomarkers, different things like that have not been noticeable before. And now we're able to compute that and indicate, something's happening in a different scenario.
We see AI as an enabler of better processing and enhanced insights for us. I know a lot of people fearmonger among AI. You always need hardware and data. to get at least a basic set to infer things. And then on the broader front, I would say what we do is we look at the science of deep organ sounds. So not anything that you can capture in ambient on a wrist-worn device or even a phone, but really those organs buried deep in our body. What are they saying to us by the sounds that they make? We know ECG, we know EKG, those are electrical signals. They've been done to death. How many people really know what your stomach gurgle means? How many people really know what the sound of some heart sounds continuously, what they mean, similarly to what we do to lungs? And so that's our vision for the future. There's tremendous utility in one device that is able to capture these personalized biomarkers at scale in a way that nobody else can. But also, just think about it. The sound that these organs make, they don't depend on geography. They don't depend on race, ethnicity, or zip code. And therefore, there's a marvelous opportunity here to understand that individual very deeply, but still enable mass personalization at scale because it's non-invasive and it's very simple to use.
Yeah. So it sounds like it's been a pretty incredible journey so far, and you got a long, bright road ahead of you. What kind of advice would you give startups that you've learned throughout your journey that you could help them accelerate a little bit faster?
Good question. And this may go against some advice startups may get. Look at the field you're in. If the product you're building, it can be classified as a gadget, and you can be an overnight success with it, and you're fine with it being a gadget. Yes, you could go right ahead and build it as fast as you need. From the time you're building a product, whether it's in the medical field, whether it's something in the energy field, and you're rolling it out to the local governments or somewhere in a country, whether it's something that's cleaning water, storing carbon, whatever it is, where the impact is going to be much larger than just simply something like a small gadget. Take the time out to have the development follow some established standard and be guided by that standard. Just take a step back. It may be a little slow in the beginning while you understand what regulations you should be bounded by. But once you do that, you can then go in leaps and bounds, because now you can have key conversations with the people who think according to those standards, and they are your end users, they are your customers, they're the people who have to champion your product. So get it right from the beginning. I
would say 3 or 4 things. One, this is said by everybody, but I just bears repeating. This is not for the faint of heart. Passion and mission are the things that help when it's 1 a.m. in the morning and you still have 3 or 4 more hours of work to do. Money and the exit isn't what drives you. What keeps you during the moments when you've heard 100 no's every day and you still have to keep going and show up for staff is the fact that this is a mission-driven company and you have a North Star. The second thing I would say is that for every technical founder out there, I don't think it really matters what field it is. If you don't spend time on marketing and sales, it's going to cost you 2 to 3 times more than technology development ever did, ever. So the faster you get to that understanding, the better. It takes twice as long, twice as much as you thought it would to get people to we're not talking about the early adopters here. We're talking about the people who will buy and allow you to scale. And the other thing I will say is really just community matters. That's been a recurring theme of everything I've said today, but community matters. We see it. We've been the beneficiaries of the community in Rochester. As part of our We Funder round right now, we are seeing the benefit of community, just people who are invested not just monetarily in your mission, but really personally as well. So out of that, we now have a whole new community of supporters, from doctors, ER docs, people who understand abstruse concepts in healthcare like revenue cycle management and risk coding, pharmacists, a bunch of people who get together and help you on your mission. I encourage every startup to think about how you build community, and not only when you want to fundraise, but community that's really invested in you personally and wants to help you.
That's great. Thanks, guys. Now, you mentioned your WeFunder a couple of times. How would somebody listening to the podcast find you guys on WeFunder?
Oh, that's easy. You go to wefunder.com/HCO, and you can see everything that we're up to and see how we're doing. So this is being recorded in April. We're just shy of 5 months on the platform, and we've already raised over $500,000. So we'll be going strong by the time this airs as well. Yeah.
Well, we're grateful that you joined us, Sharon and Jared. To our listeners, thank you for tuning in. If you're a startup or an entrepreneur in the Rochester region, I invite you to check out NextCorps at nextcorps.org. You can search for and subscribe to the Forward Faster podcast here, as well as on Apple Music, Spotify, and YouTube. And to learn more about how HCO is revolutionizing respiratory healthcare, head to healthcareoriginals.com.